That is the number one thing I tell mentees. When they come to me, probably 99% of the mentees that come to me that need help in these situations, they've gone through all of this terrible things, all these terrible things, and they haven't reached out to anybody. I don't know if it's because they're afraid or they are ashamed, which I was too. It is very fearful, and it's very shameful to go through these things. You feel like you're not good enough, because that's what they're telling you. That's what they're putting in your ear. You need someone to tell you that you are good enough. And I will tell you, anyone that's listening to this that's in this situation, you are good enough. What the enemy loves to tell you is the opposite of what you are. So if you're hearing someone tell you you're not a good person, you're not good enough, that means you are a good person. You are good enough. Imagine in 2012, which wasn't that long ago, I was told that I would never be a surgeon several times. I was told, look at me now. Not only am I a surgeon, I'm 4. Okay. You have to believe the opposite. You know what you're capable of. You know what you're capable of. Use that energy to propel you forward. Stand up for yourself. It takes a lot of energy. I understand that, right?
All right. Welcome to another podcast of the Black Surgeons today. I have the privilege of having Dr. Kanene Ubesie. She's a trauma surgeon, and I'm really excited to have a trauma surgeon here today to just kind of let us know about the path from general surgery to acute care surgery. Dr. Ubesie, thank you so much for being here, and I'm looking forward to talking to you.
Thank you. Thank you for having me. I'm looking forward to telling you all the details.
Love it. So why don't you just start telling us a little bit about who you are and what you do right now?
So I tell everyone, just to keep it short and simple, that I am 4 surgeons in one. I'm a general surgeon, trauma surgeon, critical care surgeon, and a surgeon of burns and wounds. And I'm on this platform to kind of increase awareness in surgery and surgical education for our community, but not just our community, all communities as well, and just get the word of surgery out there and to normalize what a surgeon looks like now as opposed to 50 years ago. It's a very different picture, and I think society needs to see that normalization.
I love it. And so where are you from? Where did you grow up? And maybe where did this passion of becoming a surgeon for the people came from?
Yeah, so both my parents are Nigerian. They came to the United States in the late 1970s. I dearly love them. My dad's an OBGYN, and my mom is a business manager. She has her master's in both health administration and public administration as well. I was born here in the States. I was born and raised in Houston, Texas. And my dad moved kind of all over to complete his residency. He went to UT Southwestern Medical School and then finished his residency in OBGYN in Kanene Hospital, which is no longer, I think it's Drexel Hospital now, in Philadelphia. And then we moved back to Texas. I've always wanted to be a surgeon. It actually started, I think as early as 5 years old. I wanted to be a brain surgeon. I didn't know it was called a neurosurgeon at the time. I just wanted to operate on the brain. Then I got to medical school and I was like, there's a lot about the brain that we don't know. And so I'm going to have to be doing a lot of research until who knows when. So I kind of changed gears, and then I was interested in plastic surgery. Did about 7 years total in research and followed plastic surgery mentors. Then when I got into general surgery residency, at the end of my residency, I kind of thought that I wanted to do more of the internal type of general surgery, not just plastic surgery, surface surgery. And so I did a fellowship in burn surgery under a plastic reconstruction program in Virginia. And I realized halfway through that program, I don't want to be a plastic surgeon. So even later in my career, imagine I'm a fellow right now. I'm a fellow, and my whole career was built on plastic surgery. People that talked to me who knew me was like, that's going to be the next plastic surgeon. And I still was able to pivot late in my career, my training career. So I woke up one day halfway through my burn surgery and was like, I don't want to be a plastic surgeon anymore.
Wow.
It's just not me. And that was one of the most pivotal decisions for me, because I am definitely not a plastic surgeon. I am purely an acute care surgeon. I love trauma. That is my jam. So I went back to my program director and I was like, hey, guess what? I'm going to be a general surgeon. He was a little disappointed, but he was like, okay, that is your decision. And I think you've spent enough research in trying to figure out the two. And so he helped me in that. My mentor, who's known me since I was 4, he is a good friend of my dad. They went to the same medical school, so that's how he's known me since I was 4.
Mm.
He helped me get a job in Dallas, and that's where my career took off. I went to Dallas and worked there as a general surgeon, part of a hospital group, and built a clinic. And then I was like, you know what? I like critical care. So I actually took an 80% pay cut, left my clinic, went back to fellowship. So it's possible. You don't have to do everything in the traditional manner. Went back to fellowship, did my critical care fellowship, and then my trauma career took off.
Wow, that's amazing. It just sounds like there was a lot of bold moments that you kind of had to sit down and make those big decisions, which it's a little bit
Yes,
scary, I feel like, in medicine especially.
it is. You have like this stair step or
Yeah.
plan that they put in front of you,
Hmm.
and you're almost like, I have to do it in this sequential order,
Yeah.
or I'm not going to make it.
Yeah.
And you don't have to. You can actually make your life the way you want it to be. Now, it's going to be a little bit longer of a road.
Hmm.
I added maybe 2 to 4 years on my road, but look at me now, right?
Hmm.
It's 2 to 4 years that went into my armamentarium of what I'm doing now, and it didn't really set me back. So you can do it. It's possible. You don't have to do what they're telling you to do.
That's very true. But I want to take us back a little bit to like high school time. So you
Mhm.
knew you wanted to be a doctor. So what kind of preparation were you getting yourself into during high school time to be a physician? And then what did you decide to go to college?
So I knew, fortunately for me, I knew early on I wanted to be a doctor.
Hmm.
So all of my education was geared towards basic sciences.
Mm.
So in high school, I made sure I did well in my chemistry classes. I was in AP courses.
Hmm.
I made sure that I excelled in all of my grades, and I got to know my teachers as well in all of my science classes,
Hmm.
and they helped me. I didn't really rely on the advisors in the high school. A lot of advisors from my friends, they were telling me that they were discouraging them from medicine. So I knew, I was like, okay, I don't need anybody in my ear discouraging me from medicine. They may have encouraged me, who knows? But
Hmm.
I definitely did not use the advisor. My advisor was actually my father, and I
Mm.
was very beneficial with that to have. That was a good benefit for me, a great blessing for me to have a person in my family
Yeah.
that was a physician and could guide me.
Hmm.
Not a lot of us have that blessing.
Yeah.
So I listened to him, and I didn't follow his exact footsteps, obviously, because he's a foreign grad.
Yeah.
But I was able to at least I was able to follow his guidelines and his advice.
Nice. And
Yeah.
so where did you go to college? And then what major did you major in college? Were you pre-med
Yeah.
and
I was pre-med, and I majored in biochemistry, also an advice of my father.
mm,
I was that majoring in biochemistry was probably one of the best moves in college that I could have made.
mhm,
It gave me 6 months of breathing room in medical school, starting off, because we all take biochemistry your first year. And biochemistry is not like math. It's not something you just pick up and do. And it's not just something you just pick up and do and go forward. It's actually a hard subject. And so me majoring in that subject gave me some breathing room to kind of transition from college to medical school.
and so you decided to go to medical school. But before getting into medical school, were there any challenges in college that you feel like, man, maybe this dream that I've had since I was 5 might not happen? Or did you feel like everything was kind of going into
Well, definitely not. I did not feel like everything was going to plan. There's definitely some cases like OP Chem, advanced calculus, all of those classes. I was just like, okay, maybe this is not for me. But I was very determined to make a way.
hmm
I think I heard in my freshman year, a C is passing, C equals MD.
hmm
Not that I was striving for a C, but that really resonated with me,
Yeah.
that I don't necessarily have to stress about being the best, getting the best grades, even though I did. But there was wiggle room. There was a grace area where I can relax
Yeah.
and try to do the best I can, and then still I can achieve what I want to achieve.
Yeah. Yeah, nice. And then how was it prepping for the MCAT? I guess during that time it was probably
Oh
very
gosh.
different. I just know myself that was one of those challenging times trying to maintain your grades and then oh man, I
Mm.
got to do this MCAT thing. How was that for you, I guess, during that time?
Yeah, studying for the MCAT and preparing for the MCAT was a really trying time for me. It was probably one of the darkest times in college.
Mm.
I did get help from study organizations, and I was able to use use those organizations and use the time that I spent and I paid for to study for the MCAT and prepare for the MCAT and move forward. My MCAT scores were great, but they weren't superb. And I was just wanting to maintain a great score so that I can have access to multiple medical schools. And I think that is what we should all strive for. Trying to get like the perfect MCAT score, it can put a lot of stress on you and can discourage you from moving forward. And I always tell my mentees, you know, I want you to do your best, but do not put that stress on you to be the best. Okay. If you do your best, you're going to be the best at some point, right? You have to move forward. You have to make this enjoyable for you. You have to make this something that you actually want to do. Don't sink your ship when you're in the shallow water, right? Yeah. You still got a whole ocean to sail. Okay. So do your best now. And don't worry about the hard stuff. You know, the hard stuff is coming. Trust. Okay. This is the easy part.
Yeah.
So use all the tools you can. Go to all your mentors, go to all your teachers. There's so many study companies out there, study tools that you can use. So use them. If you don't have the financial status to afford them, ask people. Go to your schools. Your schools will be able to help support you for those things. And try your best.
That's a really good advice. I feel like whatever stage of life we're in, it's like we think like that's like all we have. And then once you pass through that challenge and you're like, I guess there's more. So there'll always be more. So you might as well just like settle down and enjoy the process.
Yes, enjoy it.
Now you're in medical school. Tell me a little bit about that experience and what made you want to go into surgery during that time.
Okay, so I always tell people medical school was the most pivotal portion of my life. And the reason for that is in medical school was the first time I realized I was Black. My parents never raised us to know color or race. They always raised us to love everyone and have, regardless of their background, regardless of their race, regardless of their language, whatever, everybody's the same. Everybody is on an even keel and you love and appreciate everyone. That was their thing. And so I went into medical school, actually every level of education before medical school. I go in and I see everybody the same. My third year in medical school, I saw my surgical rotation. And obviously I wanted to be a surgeon. So this is a rotation that you have to do well on. You have to know your clinical clerkship director. You have to know all the things. And this is where you want to excel, right? And I was on this rotation with another individual who was also wanting to be an orthopedic surgeon. And I guess to this day, I don't know what the issue was. I will say the other individual was Caucasian. She was female, older. She was held behind a year for academic whatever. And she was also at the time going through a divorce. So she had a lot of stress on her. So maybe she was taking her stress out on me. I don't know. So I was doing well, excelling well, and she wasn't. And she decided to try to derail me. And so a couple of things happened. She would throw my notes in the trash or throw coffee on my notes. She would ram into me while we're rounding, just little things like that. And eventually I put my foot down. I was like, hey, what's going on? She lured me out into a hallway. I was like, okay, now we're going to talk about it. What's going on? One thing led to another. She ran crying to the dean's office that I was threatening her. I've never been in this situation before. I've never even been in the principal's office before. I've never been in trouble before. So I didn't know what was going on. I was just like, I thought she was having a mental breakdown. And so I was like, are you okay? Why are you crying? Like, what's going on? Long story short, it was just a plot for her to try to derail me. And she ran to the dean's office saying that I was threatening her. And, white tears. So they believed her over me. They didn't even know who I was. They knew who she was. They didn't know who I was. They were like, who is this girl? All of a sudden, like, where did she come from? It's been 3 years of medical school. We've never seen her face. And so that was an eye-opener for me on what it's like to have brown skin. You're never trusted. You're never believed. You can be the most perfect person, which I was. I was making great grades, never in trouble, but it doesn't matter. What comes out of your mouth is not the truth. And so her words were believed over mine. I was expelled for a week and I had to remediate that at the end of my third year. She dictated what happened to me. She told them that she wanted me to go to anger management classes. My parents were like, my daughter? this one, the one that's never been angry in a day. And so it was just very interesting. And so all this went into my dean's letter.
Wow. Man,
During my surgical
that's
rotation.
serious.
It's serious,
Oh
yeah.
my gosh.
I had to sit in front of the clinical clerkship committee. They had to decide what to do with me. This was just all an eye opener because I've never in my life been in any trouble. So imagine going from 0 to 100 in the span of a month, right? And all because someone decided to derail you, maybe out of jealousy that you're going along just minding your own business. I don't know. There's definitely was some discrimination and racial bias in there across the institution, not just from her. So, but my parents and I, we fought, and we had my dean's letter revised. It's still there, but it's not as flagrant as it was when they first wrote the dean's letter. I didn't match because of this.
Man.
I had to, so, me going into general surgery was a trial, right? And that was the end part of your question. Yeah. I eventually matched into general surgery because I maintained my integrity and somebody gave me a chance. And this is what I always tell my trainees and mentees, even my mentors and friends and family. Always look for that opportunity. Always look for that chance. A no is not always a no. It's just a no is just you have to pivot, find a different way, learn another option. Okay, there's always options. Going what society would call the traditional way is not always the option. Yeah. Not everybody's going to go the traditional way. And one slammed door in your face opens up a window. You just have to find it, right? And so what you guys call, I think, SOAP, I had to, when I didn't match, I had to scramble. We called it the scramble back then. And I called so many institutions and they would read my dean's letter and be like, oh, she's a problem. It's like, no, I promise you I'm not. And you don't want to explain these issues to the institution because, you want to take ownership and move forward, right? And my goal was to be a surgeon. My goal wasn't to be the poster child for discrimination. That wasn't my goal. And so I had to take some stuff on the chin. I had to absorb some things in order to make my dream of being a surgeon be true. And so I remember Carolian Clinic. Her name is Stacy. She was the program director at the time. And I remember that phone call. I was in Texas. She was in Virginia. So it was 7 a.m. for me, 8 a.m. for her. And we got on the phone. It was just a really comfortable conversation. And I remember her telling me, man, it's like I've known you forever. I was like, yeah, well, now you know me now. And she fought for me to get into that residency program. If it wasn't for her, I wouldn't be who I am today. And just from a simple conversation, just from being kind, being respectful, all the things that you would do to kind of gain somebody's influence was what propelled me forward. And she honestly was the last institution I called. And I prayed before that. I was like, God, I don't know what else to do now. She fought for me. She told the program director, you need to get this person in. I have a feeling about her. She's going to be great. And here I am.
Wow. Well, that's a lot. And I can't imagine just, investing so much time, medical school is not easy, right? So you have invested all that. Your family has invested a lot. And then somebody just kind of taking that from you. I just can't imagine. So I'm so sorry for that you had to go through that.
Oh, it's okay. Man. I am not sorry because you know what? It made me stronger. I've learned the system. I've learned the system from a young age, as a young medical student. And from there, I was able to overcome the system. Yeah. The system is not made for us. And I know you have multiple backgrounds of audiences watching, but I want this to be out there. The system is not made for Black or brown physicians. Absolutely not. In fact, it's made to keep us out. And I am very thankful that God showed me an opening and showed me how to navigate the system so that it works for me. And because I was able to be exposed to the system early on, I didn't go into it naive. Because I was very naive. I was very naive in medical school. I trusted everybody. Everybody was my friend. I thought everybody was for me and support. Imagine having that mentality going into residency and as an attending, it would have destroyed me, right? And so I'm actually thankful for that situation. I'm thankful for all the other situations that I experienced in residency and after training. All of those things made me stronger and it made me the best surgeon I can be.
Yeah.
I know nobody can beat me on any type of knowledge of surgical material. Nobody can beat me on expertise. I am the best that's out there. And I attribute that to all of the adversity that I've experienced since medical school. So I'm grateful.
That's amazing. When you talk about you had to learn the system, I know one of example of that is, what you just went through, but maybe over time, what kind of things, or what kind of advice would you give, people who are kind of in that space, like where you're saying you're just kind of like, oh, everybody's for me, but like, what kind of things should you be looking for, and should you do to kind of know, like, okay, like I'm trying to also guard myself and my career as well.
Yes. The one thing that I tell all of my mentees is find someone in your space that is for you. And this is not a feeling. It's not this person, I like this person. I think this person likes me, so I'm just going to stick around with them. No, go up to that person and say, hey, I need someone to go to when I fall through the cracks. Can I rely on you to support me? You have to actually verbalize it. There's something about verbalizing it and asking the person that makes them want to help you and look after you. I will have to say the few mentees that came up to me and asked me to do that for them, I will always have their back. I will always look out for them. Even when they make a mistake, we're all going to make mistakes, right? We're all going to make the wrong decisions at some point. Even when they make the wrong decisions, I still will have their back and say, hey, this is what you should have done. You didn't do it. Let's backtrack and find another way, right? The ones that don't verbalize the need for help, I kind of, looking over them, it's not a solidified relationship. And so looking back, I went through all of this and, I've had other instances during residency and post-training. I didn't have a mentor. Right? Now I do. Now I realize the golden aspect of having someone to bounce ideas off of, having someone to fall back on when you hit a wall, right? And so that is the number one thing I will say. Even in medical school, start early. Find that professor, lecturer, someone that's in a higher position that you are in, possibly in the same specialty, and go up to them. Schedule a meeting, office hours with them, and say, hey, I need someone that I can fall back on because it's going to be a difficult road for me. Will you be willing to be that person? And be prepared for the no, okay? When you do verbalize it, there's going to be some people that are going to be like, no, and that's okay. Thank God. Thank God they were truthful enough to say, oh, I can't be that person. Because imagine if they're like, oh, okay, I'll be it. And behind the scenes, they're secretly not for you. That's awful, right?
Yeah, that's true.
So there will be people but make sure you're able to discern those relationships so that you do go to your probability of having a yes is high.
Yeah. And so, you make it to residency, thank God, because that sounds like it was really tough. If it was me, I feel like part of me feels like, man, would I even keep going, And so
I'm gonna tell you, there were some times I was in the corner of my closet, boo-hooing, talking about, I don't know, this is for me.
I can't.
The guy was like, you better get up and show them what you're talking about.
Wow. So how was residency for you? I know for most people, I know for you, medical school sounds like it was, I don't know, a lot, but residency is another place where most of us, we get probably the hardest time of most people's lives, I would say. It's just the workload and everything. And so how was that for you? And how did you overcome all the workload?
I would say of all of our careers, residency is definitely the most difficult time. And it's the most difficult time because if you calculate the hours and what you're paid, you're actually being paid below minimum wage, right? And you're working long, long hours that you're not used to. You have to switch from studying and taking tests to actually taking care of real people. And that's in itself is a huge responsibility and lots of energy that you expend, right? Then you have real life bills. You're getting paid, but not enough. And so you have all these real life bills to take care of. You start having families. That's when people start, expounding their social boundaries. And so you have new responsibilities, new social responsibilities, new familial responsibilities, new work responsibilities. There's a lot that happens during residency, and it's really a real pivotal time. So my residency experience was amazing. Let me just start with that. But it was also eye-opening. I was a resident at Carilion Clinic, and I got to my 4th year, and we got a new program director. I got to my PGY 4 year because of the whole match situation. I had to do a prelim year, which I was grateful for. And then I started over as a categorical PGY 1. So my PGY 4 year was my 5th year in residency. And so I was excited. I had one more year left to go. And so halfway through my PGY 4 year, we got our 4th program director. It was a very volatile program. Program directors were leaving left and right. So we got our 4th program director. Oh, I don't know. I guess my brown is more brown than other people. I don't know. I was just the target. I'm sitting here. And maybe because I'm always happy. To this day, I don't know what it is. I also do speak up for myself. So maybe they don't like that. People don't like brown people talking. So, so he did not take a liking to me. And he had to create a space to allow a Caucasian male had left for research, for pediatric surgery research. And the program that he went to, they really enjoyed him. He's actually one of my good friends. The pediatric resident fellowship program that he went to for research wanted him to graduate, come back early instead of 2 years. They wanted him to come back 1 year so that he can go to their program on time. And so that meant my program had to create space for him because they had space for him to come back after 2 years, but not 1 year. And so this was the year that we had the new program director. So he had to make space for this Caucasian male to come back, meaning he had to get rid of a resident or hold a resident back. So I guess I was the one that he chose. And so he went on I don't know what other word to use, but a witch hunt. And I had nothing in my file but good recommendations, good things in my file. And so he went on a witch hunt to ask nurses about me. And the ones that didn't particularly care for me, he put those evaluations in my basket. So basically, he built up a negative rapport in my file that was good. And based on that rapport, he wanted to hold me back, possibly fire me. So I lawyered up. By that time, I realized what to do when you get into those situations. I lawyered up. The hospital was going to fire me, but they were like, oh my gosh, she has a lawyer. Probably that's not the best idea. And we can get disbarred from the ACGME if we do that. And so, or at least put on probation. So they decided not to do that. They gave me a chance to repeat my 4th year. And I signed that contract. I signed that contract. But in the meantime, I was looking for places to transfer to. And when you need to take your boards for general surgery, this is something that not a lot of people know. You have to do your last 2 years in the same institution, or you cannot sit for the boards. So I knew going into looking for a new program that would have to repeat my 4th year anyway. And I was okay with that. That place was just toxic, volatile. I needed to get out. So God would have it that one of my letter writers was a previous trauma surgeon that had left the program because it was so volatile. He went up Northern Virginia to Inova Fairfax, and he was a program director there. And so they had a spot open for a 4th year resident, and he was like, hey, you want to come up here? You were great. In fact, you ran the ICU as a 3rd year resident. I've never seen a resident run the ICU like you did. You were on top of things. You had control over the younger residents. You were covering 5 ICUs by yourself as a 3rd year resident, right? Wow. So he was like, come here. If they don't want you, we want you. And this is going back to the opportunity. Find those opportunities. You really have to look for those opportunities. I remember he wrote an excellent evaluation for me during that ICU rotation. So I went to him. Can you be a letter writer for me to transfer? And because he was a program director in his program and he had a 4th year spot open, he called me. So I used one of my days off. I drove 5 hours north, interviewed, drove 5 hours back. My institution didn't even know. Everybody loved me, and they hired me. And so I was able to transfer, and it was the best 2 years of my residency career. It was so amazing to go from a situation where you have no support and no encouragement to a situation where you have all the support and encouragement. It really does matter. And I am a living testimony to how much it matters to encourage people, regardless. Like, they can be the worst surgeon ever. They can have the worst knowledge ever. If you put encouragement into those people and put in support and affirm them, you will see multitude of improvements. Wow. And that's why it's important to do that.
Wow. I was fuming a little bit as you were telling me all that, but that's tough.
Yeah.
I'm just trying to imagine myself as you're telling me that. First of all, it's not acceptable. I feel like the fact that they had,
It's not.
the fact that you had to transfer. Just wondering, like, could there be anything else that you got? I just feel like those people shouldn't have gotten away with so much. This is your life, and I feel like they were playing
Right.
around with your life, and it's just not fair.
And that's what these programs do. And that's why I am banning or joining forces with organizations to help prevent things like this. Because believe it or not, my situation was mild.
Yeah.
Okay. Because I was able to protect myself. I knew what to do. I had documentation. I had legal representation.
Yeah.
There are residents out there right now that don't have any of that and are on the fence of being terminated for reasons that no one could understand. And there's nothing on paper. No one can, we just don't like their vibe. That's the reason right now for a resident that's on the chopping block right now, because they don't like her vibe. And she happens to be the only brown colored resident in the program and the second one since the program ever. Right?
Yeah.
Since the program opened ever. So you know where that's going.
Yeah.
What does vibing have to do with providing surgical care and training?
Yeah.
And it's sad. Like this is prevalent right now in residency programs, and nobody knows about it because nobody is talking about it.
Yeah.
And I think people like me that go through so many of these instances and have to fight through it, by the time we get out, we're so wounded and bruised. We're still licking our wounds, and we don't have time or the energy or the capacity to go back and pull other people out.
Yeah.
Well, I do. My wounds are healed, baby. Okay. So I am ready. And so I am joining forces with organizations and people, influential people, to help eradicate this because it's bad. Yeah. And with the current political climate, it's going to get worse.
Yeah, that's true.
And I think the main thing with residency programs, general surgery, as hard as it is, just baseline, the training for surgeons, as hard as it is, we don't need to make it any harder, right? While our counterparts have the free reign to think about their studies and learning surgery, we as a Black and Brown community have to use some of that brain space we can be using to be the great surgeons that we can be. We have to use some of that brain space to fight to survive. It's not that we aren't capable of learning the education. We don't have the 100% brain space as our counterparts to learn that education because we are trying to survive the unfair discrimination and bias that we are up against.
Yeah.
And so it's as you can see, it's a passion of mine.
Yeah.
And surgery itself is, like I said, is hard. Yeah. And we don't need to expound that with more hardship.
Yeah. As far as, when you're picking for residency, when you're matching, because that's one of the things I feel like it's so important when you're going around and interviewing, trying, as you say, the vibe, but trying to see what that program is like, trying to look at the history of the program, right? What kind of advice would you have for people? And I know matches happen, but when they're interviewing, what should they look for in this program to make sure they have that safe environment for them to train?
Great question. First and foremost, you're going to be a surgeon, right? Relationships are great. Having a good, I'm going to use this word, having a good vibe with the program is a great thing, but that's not what creates a surgeon. A good vibe doesn't make a surgeon. You have to prove that you can pass those standardized tests. When hospitals want to hire you, there's a couple things that they look at to hire you. When you're straight out of training, they look at your standardized testing. Did you take the boards, right? How many times did you take the boards? And what kind of disciplinary actions were against you? Those three things coming out of training are the top three things that institutions use to weed out who they don't want. They want to know that you passed the boards, how many times you took the boards, and your step threes, and the step threes, they care about your score as well, and any disciplinary actions that were against you. Now, what you learned in training, they don't care about any of that stuff. If you had best friends, they don't care.
That's true.
So your ultimate goal is to get a job somewhere. Yeah. When you're at the match portion, you have to make sure you go to an institution that will prepare you for the boards and prepare you well. An institution that will provide you great recommendations. So when you're looking at a program, yes, look at a program that you feel comfortable in, because ultimately, if you're depressed and in a toxic situation, you're not going to do well academically. But that should not be your number one guideline. Your number one guideline is look at their board pass rates, right? Don't only look at their board pass rates, because a lot of institutions will tell you, yes, we have a 98% board pass rate, but when you look at how many times their residents took that board, you will see the retention rate or their first time pass is much, much lower. So they'll get all of their residents from 10 years past and see who passed the board. And then you also have how many times they took it, right? They won't tell you the pass rate on the first time. So ask about that in your interviews. Okay, you have a great board pass rate. How many of those residents passed in the first time? That is very important. The second thing is look for institutions that have professors that sit on ACGME boards, professors that may have ACS positions. American College of Surgeons is the big umbrella. You want to see professors that are heavily involved in the American College of Surgeons. Like if you're like me, you want to go into trauma surgery, look at the attendings. Are they involved in organizations like EAST? Are they involved in organizations like AAST, the trauma organization, the Committee of Trauma, the COT? Those things are what you really want to gravitate to. If you're going to plastic surgery, are your attendings involved in those organizations? Because ultimately those attendings will know people that know people, right? Yeah. And so if those attendings know people, all we have to do is pick up the phone. You'd be surprised how many jobs and residency positions are made by people on the phone. Yeah, they'll type stuff, the cute stuff on paper, but that doesn't really make the difference. Yeah. And then you're like, okay, well, I have a great letter of recommendation. That also doesn't matter. Yeah. I interview. I've hired people, hired surgeons. I've hired APPs. I've interviewed for medical school. I interviewed for residency. I interviewed for a fellowship. Trust me, we don't look at those letters. Nobody reads those letters. And then when we do, we're reading it because we want something to pass the time while we're waiting for the next interviewee. What we look at is the names, right? And those are the names that we're familiar with because we're all involved in organizations. Yeah. That is what we look at. So you want to make sure, even in medical school, get in touch with the people that are involved in societies and organizations and have those people be your letter writers. It's sad to say, but it's really about who you know. Yeah. It is all about who you know. You can be top of your class, yada, yada, yada. It don't matter. Get to the person that knows people, and that will be ultimately your leg in. Now, after all of that, you looked at the board scores, you looked at the attendings and who they're involved in the society. Then you want to do the vibe. When you go to the interview, talk to the residents, right? Don't talk to the residents that are in the limelight, that the program puts in the limelight. They always put their best residents forward, and then they tell those residents to make the program look good. I know I was one of them. So talk to the resident that's in the back of the room that's not saying nothing. The resident that looks kind of disheveled. That's the one you want to talk to, okay? That's the one that's living the life, okay? So the one that's all nicely done, buttoned up, freshly shaved, got a fresh cut. Talk with them. They'll give you some information. But the one that you see in the back, the one that ran in kind of late for the luncheon and kind of gobbled up their food and ran out, that's the one you want to talk to.
The one on consults right now?
Yes. They'll tell you the tea. They'll give you the real tea. And that's what you want to know. Like, the good stuff is the good stuff, right? Every program is going to put their best foot forward. They're going to show you their representative on interview day. You want to find out what the valleys are. There's mountaintops and there's valleys, right? And you're going to go through the valleys. Everybody enjoys the mountaintops. That's easy, right? Jumping from mountain to mountain, that's easy. What really determines how well you'll do in that residency is how well you can tolerate the valleys, okay? Every residency program has valleys, bad points, things that they don't want to show to the world. That's fine. You have to determine if that's what you're willing to tolerate, right? If you go to a residency program where they don't have any transporters and you have to transport your own patient, if you're okay with that, that's great. If you go to a residency program where, I don't know, they make you, this is my burn program. My program director made us go up 8 flights to the burn center, discouraged the use of elevators. And I see why now, because he wants us to be physically fit to tolerate the hot rooms in the OR. So he was like, you only use the elevators twice a day, right? And so every other time you had to go up 8 flights of steps. Wow. And he would go up with us. And so I was okay with that. I mean, I was a marathoner. I was like, okay, let's go, right? Some people are not okay with that. right? So those are the things you need to find out about residency.
Yeah. Well, that's amazing advice. So thank you for sharing all that stuff. I feel like there are so many gems in there. I could just see myself, when I was a medical student trying to match into ENT, super competitive. But, as you said, it's so key to like have people who are known on the field to like vouch for you because like their word is so much bigger than that later, as you said. It's like when those people are willing to take their phone and call somebody else, that shows something about who you are. So,
It does.
and at the end of the day, residency is about, training somebody you're coachable, you're teachable, right? And then you want to
Right.
train somebody who you're willing to put up with for the next five, whatever years. So,
That's it.
so
Exactly. And you have more power. I want to let all the medical students out there know, and residents as your job interviewing, you have more power than you know, right? If they asked you for an interview, they want to you.
Yeah.
Gone are the days where they just cherry pick or cherry shot interviews. If you get interviewed. No one's doing that because no one has the time.
Yeah.
And for them, and setting up interview days is a lot of money for residencies. Takes a lot of money, a lot of time.
Yeah.
Imagine if you're, especially for a surgical specialty, they have to get together all of these surgeons' schedules for one particular day. Do you know how hard it is to get scheduled surgeons to meet at one particular time for a whole day? Those surgeons are actually losing money because they're not in the operating room. That institution is losing money because they don't have these surgeons, these big name surgeons in the operating room. Yeah. So not only are they losing money, they're dishing out money, to create this interview day. They're feeding you. Some of these institutions, they have hotels for you. So they're losing a great amount of money to get you to be interviewed. Yeah. You have power, more power than you know. They want you. Right? And so not only do you put your best foot forward, go in there with confidence, knowing that this is my decision. Yeah, it's a match. And ultimately you guys got to match together. Fine. It's logistics. Yeah. But you also have the power, right? You have more power than you know.
Nice. I love that perspective, actually. I feel like most of us don't go in with that mindset, We go in more, it's like, oh, please pick me, instead of be like, I'm supposed to be here.
Don't pick me.
Yeah.
No, don't go in there with the pick me attitude because they are losing money. They paid for you to be there, right? They're not going to pay for someone they don't want to be there, right?
That's true.
Now, there's levels to it. There's people they really, really want, people they don't really want, but they want you there. So you do have power.
Yeah. I feel like we were in residency and we kind of expanded on it a lot, but I wanted to get into kind of fellowship time and like why did you choose to do plastics, and kind of expounding on what you talked about changing your career and what went into that a little bit.
So I did burn. I found a mentor towards the end of my residency. That mentor turned out to not be the best mentor. He had other personal agendas for our mentor relationship. So I want to warn all the females out there that some men in power, especially in surgery, vet your mentor. They may not always have academic reasons to be your mentor. It's very important. So, but he did funnel me towards burn surgery because I was thinking about not doing plastics and I wanted to have more time to decide. So that's why I went to my burn fellowship right after residency. And it was actually a really good time, because of my burn fellowship. I'm a wound surgeon, and I'm a really good wound surgeon actually. And I can skin graft like the best of them. And so I really learned some techniques outside of general surgery that set me apart from all the general surgeons. And so I really appreciate that year of fellowship. So I really went into there to kind of differentiate between whether I wanted to go to plastics or general surgery. So I'm appreciative that year. And then I started my career as just a simple general surgeon, doing the lumps and bumps, appies, appendixes, gallbladders, hernias. I got really proficient in doing hernia repair because my mentor was an expert hernia, was a hernia expert. And so he taught me all the tricks of the trade. I will say residency builds the foundation of your surgical skills. It's not until after residency that you actually excel on them. And so make sure you can find someone that you can be under their wing so they can show you all the things that you don't learn in residency. Residency is just the foundation, the blueprint. You still have to build the house, right? And so you build the house outside of residency. And that's what he showed me how to do. So during those 2 years, which were my first 2 years as a real doctor, I realized I really enjoyed the critical aspects of my patients. And I actually took ownership of my patients, my surgical patients in the ICU. We had an ICU that was run by hospitalists, and they took care of all the patients, regardless of specialty that came in there. And when they realized that I was taking care of my patients, they were like, hey, can you help us? Can you take care of your patients? And so that we don't have to. I was like, of course. And so they were so happy that I took that ownership. And I was like, I think I can do this for life. So I made the big decision to close up the clinic and move to Albany, New York. Me, little Texan Southern girl. In Albany, New York. And I did a surgical critical care fellowship, 1-year fellowship. I know now there's the ACS 2 years. And it was wonderful. I absolutely loved it. I didn't love the snow. I could do without the snow. But I loved the whole aspect of critical care. I fell instantly in love with it. I went to an East conference. It's a trauma conference for younger trauma surgeons. And I found a job with Envision Physician Services during that conference. Residents, if you're looking for a job, go to the conferences. And I know you want to go to the conferences and listen to like the talks and the journals and the written papers and the posters, but go to the exhibits. Hospitals are there. There are companies that are there. They are offering jobs. Spend most of your time, especially in your second to last or last year, spend most of your time at these conferences at the exhibits. That is where you'll find your jobs. So a little tidbit. And so I got a job with Envision Physician Services out of Houston, went back home to my hometown and started off my trauma career. So that's how it all started.
That's amazing. And how long have you been there for since you finished training?
So I was in Houston for 5 years, and that's where I developed my trauma hands. I was a surgical ICU co-director for 4 years there, vice chair of surgery, chair of surgery, and I helped 2 hospitals during their designation processes for trauma. And I really developed leadership skills there, and Houston will be forever in my heart of creating me as a trauma surgeon, multifaceted surgeon. I had a little bit of burn there, definitely did critical care, trauma, general surgery, everything. It was a really great experience for me. Then UT Southwestern reached out. UT Southwestern affiliated with a hospital in North Dallas, Frisco. And it was a brand new hospital. At the time that they reached out to me, the hospital was 3 years old. And they wanted to turn that hospital into a trauma hospital. And actually that hospital is part of a different private hospital system, but they did a joint affiliation with UT Southwestern so that they could become the trauma hospital of Frisco. But they needed someone that was experienced. So they reached out to me knowing that I built these kind of programs. And I was recruited over there in 2022, and I was a trauma medical director, and I established their first level 3 trauma designation in Frisco, Texas. I have that legacy. I could come back years from now, and show people, hey, that hospital's a trauma hospital because I built it. Now, I will have to say those 2 years of my life were pretty difficult. I had very little resources, even though I asked for all the resources that I needed. Going into there, I knew the resources I needed. I asked for them, didn't receive them, but I still made a way out of no way because I was used to it. God places you in positions that you don't even know that you've already been in. So I used my non-traditional skills to produce this program. What normally takes a program full of surgeons 1 to 2 years took me 8 months to do when it was just me as a trauma surgeon.
Wow.
I had to, that's some pretty astounding numbers.
Yeah. It's crazy.
So that just attests to my dedication. And I learned how to get through adversity. I don't think if I didn't experience all the things that I experienced in residency, medical school, and even, being an early attending, I don't think I would have had the wherewithal or the energy or capacity to do what I did at Frisco, right? Yeah. And so I hired people, I expanded the team, and then once we got the designation, I left.
Wow. Well, that's amazing. Amazing career, and just can't wait to see what you're going to do more. You mentioned that your passion now has been really about, trying to take care of the next generation of residency physicians of color who, might be struggling, and sometimes maybe they're not treated fairly as they're going through the process of having their own careers. How can a resident who's going something like that right now, I guess, how can they because sometimes they might be in a program where they don't have any help. As you said, they might be the only person of color there, and they might not have as much of a mentorship or anything like that. How can they react to that kind of situation? And then lastly, how can people reach out to you? And it seems like you have so much great advice on a person who might be going through that.
Yes. So I want to offer some encouragement first. We often focus on the bad parts of our life, and it's really easy to do that. I'm a devout Christian, if you haven't noticed. The enemy will love for us to fill our minds with what's going wrong. And that's all we focus on. And if we focus on what's going wrong, we cannot be creative to focus on what's going right and move forward. So as tough as it is, and I've been there several times, as tough as it is to be like, what's going on is your only focus that you have, try to look outside of that. Try to see what you do have. Focus on the things that you do have. You're still a resident. So there's still a chance, right? There's people out there to help you. You do have that. You just have to find those organizations. And so especially in the surgical organization, the surgical specialty, the organizations you can reach out to are the Society of Black Academic Surgeons. That is one organization that I'm part of. You can also reach out to Physicians Just Equity. It's a new organization that started back in 2021 by Dr. Pringle Miller. And they're kind of just now getting their feet wet and trying to assist and create a program for people that are in these situations. Also, reach out to your local NMA chapter. If you don't have one locally, there's an NMA chapter around you. Go to the conferences. And I know as a resident, it's hard to get the financial backing for these conferences. Most residencies will have stipends for you. And so choose a conference a year that will not only propel or progress your surgical career, but also you can find support and mentors. And when you go to those conferences, I know it's tempting to go to the happy hours, to go to, find your friends and, let your hair back. It's very tempting. But please, whatever you do, come out of those conferences with people you can call for help. That is the number one thing I tell mentees. When they come to me, probably 99% of the mentees that come to me that need help in these situations, they've gone through all of this terrible things, all these terrible things, and they haven't reached out to anybody. I don't know, it's because they're afraid or they are ashamed, which I was too. It is very fearful. And it's very shameful to go through these things. You feel like you're not good enough, because that's what they're telling you. That's what they're putting in your ear. You need someone to tell you that you are good enough. And I will tell you, anyone that's listening to this that's in this situation, you are good enough. What the enemy loves to tell you is the opposite of what you are. So if you're hearing someone tell you you're not a good person, you're not good enough, that means you are a good person. You are good enough. Imagine in 2012, which wasn't that long ago, I was told that I would never be a surgeon several times. I was told, look at me now. Not only am I a surgeon, I'm 4. Okay. You have to believe the opposite. You know what you're capable of. You know what you're capable of. Use that energy to propel you forward. Stand up for yourself. It takes a lot of energy. I understand that. Right. So the main things, find an organization, Society of Black Academic Surgeons or Physicians Just Equity. Go to the conferences. If you need assistance with the conference, find a Black surgeon out there and say, hey, I need help to get to these conferences. Is there any way you can help me with options for financial backing? And find yourself a mentor. These are the top 3 things. I will add a caveat out of all these things, get legal representation. Find an African-American attorney. I'm going to say that again. Find an African-American attorney or attorney of your same race, because there's not just Black people that are going through this, it's other brown counterparts. Find someone of your race, because they will understand and they will go that extra mile for you. Okay. If you're a female, find a female attorney. They will jump through hoops for you. Okay. And help you. Maybe even give you a discount on the prices as well. You need legal representation. That's the only thing these institutions hear. And how you get them to do what you need to do is if they lose money. They don't care about being nice. They don't care about your career. They don't care about anything of that nature. What they care about is their money. You have to hit their pockets. They care about their money and their representation and their standing with the ACGME. Those are the 3 things you need to hit. Their pockets, their representation in the community. Get on all the sites all the IGs, all the Facebooks, all the news sites. Get in front of that camera, tell your story. That's what they care about.
Mm-hmm.
And they care about their standing with ACGME. Write the letters to the ACGME. Tell them what's happening. And then you can get in contact with me. So right now I'm in the season of Lent. So one of the things that I gave up for Lent was my social media presence. It's very hard because that's where my business comes from. But, I'm giving that up to the Lord and surrendering. So I am not on IG or Facebook right now until Easter. But you can get in contact with me on LinkedIn, Dr. Kanene Ubesie. And I'll be sure to get back with you. And then in the future, we can connect either on IG or on Facebook as well.
Sweet. Well, thank you so much for making the time. This was very inspiring, very motivating. I feel energized right now to just go back and get some work done. But yeah, thank you so much for the time. And again, your story is really inspiring to know that you have gone through so much and you're here. It's going to inspire a lot of people. So please keep going with the mission that you have. Thank you for what you're doing.
Thank you so much for this platform. I know I expounded a lot on diversity and discrimination and bias, but the world of general surgery is so rewarding. There's so much more out there than that. That's just my story. There's so many other surgeons that have such beautiful stories. Go back and look at all the podcasts that are on this platform. Reach out to me. I'm full of knowledge. My head looks small, but it's really big. Let me tell you. It's full of big of knowledge. And so I really love surgery. I'm passionate about it. I'm passionate about saving lives. I'm passionate about education and surgery. So please don't give up, and please don't give up in your specialty as well. We need more people like you. So thank you.
Thank you so much. Hey guys, so thank you so much for watching another episode of the Black Surgeons podcast. If you haven't already, please subscribe to get more material like this. And also by you subscribing, it helps spread the word and for more people to view this channel. Again, we appreciate you guys and we'll see you on the next podcast. Bye.